Well, good afternoon. Welcome to our UCCS faculty, staff, and students to our January Town Hall. Again, we have more than 600 in attendance today, so thank you for taking the time to join us. As I said every month, as long as this continues to be a format that's working for everyone, we'll continue to host these town halls each month virtually. My name is Chris Valentine. I'm the Assistant Vice Chancellor of Marketing and Communications here at UCCS, and I'll be your moderator for today's town hall. Quick overview of what we're going to do today. As always, we'll start with remarks from Chancellor Reddy. And we've heard that you find the Q&A most helpful, so as we did in December, we'll keep the presentation short and focus the majority of our time on your questions. So following the Chancellor, I'll introduce our panel, and they'll answer a handful of pre-submitted questions, and then we'll open up for live questions. As always, there's a link to submit your question at the bottom of your screen. We'll do our best to get as many questions as we can in the time allotted, as this event is scheduled to last for an hour. As for your patience with any technology challenges, if we freeze up, we'll do our best to get back alive as quick as possible. So trust we'll do our best to keep this moving forward for you. So with that, I'd like to kick this off and introduce Chancellor Reddy. Chancellor?
All right. Thank you, Chris. Good afternoon, everyone. Happy New Year and welcome to the spring 2021 semester. Thank you for joining me today for our first town hall of the new year. There is a great deal of progress happening on many fronts. So I have updates in several areas that I'd like to share with you today. First, furlough relief decision. I'm pleased to share that our spring enrollment has improved steadily since the start of the year. Last week, we were 7.5% behind where we were in spring 2020. This brings us very close to the budget we established for the year. If the enrollment numbers continue to follow historical trends up to spring census next week, we will be able to bring furlough relief retroactive to January. We'll release a statement on February 4th, the day after census, so let's keep our fingers crossed. The other good news is that applications for fall continue to significantly exceed the number of applications we received last year at this time. One small caveat. Despite these great new student enrollment projections, we are graduating rather a large class this year. So our overall SCH numbers may or may not be higher in the fall. So when we think of the fall 21 semester, I know many of us are hoping that will look just like fall 2019. Vaccines are rolling out across the country, but they're not rolling out as fast as initially anticipated, and there's still a lot of unknowns. As we understand more about the vaccine rollout, our hope is to give you a better picture of what you can anticipate for fall 21 in terms of percentage of classes offered on campus. We really hope there'll be a lot more than last fall, but we don't know what's going to happen yet. So on that note, I know that many are eager to hear about the vaccine rollout in Colorado and here at UCCS. So allow me to share everything we know about the vaccine rollout so far. The most important thing to understand about the plan to distribute the vaccine in Colorado is that it is changing constantly. The second most important thing to understand about the vaccine is that at this point, vaccines are not available on campus yet. We have applied for the CDPHE, which is the Colorado Department of Public Health and Environment, to become a closed POD, point of dispensation site, to provide vaccinations to faculty, staff, and students. While we have not been approved yet, we have received word that we are moving forward to the next phase of approval. We hope to become a POD site for phase 2 and 3. Again, there are no guarantees that we'll receive any vaccines at all, but we are planning and conducting POD simulations so that we are prepared if we are selected. So if you are selected, we expect to begin receiving vaccine doses this spring or early summer. Should that happen, we will communicate who is eligible to receive this vaccine based on which individuals are prioritized during that phase. Now, as far as our population goes, unless a student qualifies for a different category, college-age students in good health should expect to be in the final phase of vaccine distribution. That phase for the general public ages from 16 to 59 is expected to begin this summer. Beginning now and moving forward, if an employee or a student is notified that their healthcare provider is making the vaccine available to them, they are absolutely welcome to receive it from their healthcare facility. As I see the news, I'm encouraged by the recent news on the availability of more vaccines over the next few months. However, we'll continue to do as we have done for the last 10 months. We will hope for the best, plan for the worst, and be prepared for any scenario between. And now let me switch topics. Let me share you what's happening in the Office of Human Resources. The Position Review Committee continues to meet on a weekly basis to review requests to fill positions. Since this process began last March, the PRC has reviewed a total of 159 staff positions. 124 of those have been approved, and 35 have been deferred pending further budget certainty. 56 faculty positions have been reviewed, with 53 approved and 3 deferred. So we are working hard to restore the campus resources, especially personnel, closer to pre-COVID levels. Next, we are currently in the performance evaluation season for all faculty and staff. As you know, it's been an unusual year. So please note that on your performance evaluation document, you'll be asked about what COVID-19 had on your performance, on your goals, on your plans and outcomes. We recognize that this has been a tough year, and you may use this section of your annual review to discuss changes you might have made to your work to allow for unusual or challenging circumstances. Any questions about performance management or support needed can be directed to HR. In addition, we kicked off the performance management training for supervisors, chairs, and staff. HR is also in the midst of a stakeholder group engagement around a number of campus training modules, including implicit bias diversity training for search committees, employment law for supervisors, and conflict management healthy conversation for supervisors. So please sign up for information as it gets available through HR events, calendar, Skillsoft, or by contacting Andrew Lane. As you may have seen in last week's COVID-19 update email, there is a new leave option to support employees impacted by the coronavirus. So please visit the HR website to learn more about this expanded supplemental sick leave. We also have mental health options for employees. In addition to the services offered for students to the Wellness Center, we have heard loud and clear about the needs of our faculty and staff. So now, faculty and staff will have access to mental health counseling through the UCCS Health Circle Primary Care Clinic at the Lane Center, starting February 1st. This free option allows employees to meet with a licensed professional counselor or a licensed clinical social worker. This service is provided by the CU system and is available on a first-come, first-served basis. I'm so pleased that we're able to support our faculty and staff in this mental health area. We're making great strides on several other fronts. Earlier today, we officially launched our Alumni and Friends Volunteer Program. This is a brand new initiative. It'll serve as a centralized way for us to engage alumni and friends to support student success. You can learn more about the program at the link below. We also officially started work on the new Career Center, which will expand and move to the first floor of the University Center. This project was made possible by a generous gift from T. Rowe Price, and the center will open in August of this year. The new Career Center will be able to support the goals of even more of our UCCS students and connect them to alumni and employers. I'm pleased to announce that 5 of our faculty members are offering a forum on the COVID-19 research they have been pursuing. So all are welcome to sign up for this event, which will take place on February 10th. I'm also pleased to share an update on our equity, diversity, and inclusion efforts. We are serious about the future of EDI at UCCS. Creating a respectful, compassionate, and inclusive campus is among our most important work. It's the foundation of which all our goals and values rest. Our EDI efforts have rested on the principle of listening deeply to our campus community. Since November, we've conducted several listening sessions with campus stakeholders. Much of that feedback will shape our future EDI goals. We are looking to add a consistent speaker series as well as amplifying opportunities to celebrate and support our campus diverse populations. This includes encouraging students to apply to the scholarships available from EDI office, Application information can be found on the EDI website. The listening sessions will continue. We want feedback from every member of our campus community to determine what the EDI office becomes for UCCS. So every Friday from 11 a.m. to noon and every third Tuesday, I should repeat, so every first Friday from 11 a.m. to noon and every third Tuesday from 3 to 4 p.m., Dr. Stephanie Rose Spalding will be offering listening sessions open to the full campus community. The first session is scheduled for next Friday, February 5th at 11 a.m. So please keep an eye out for an announcement on how you can participate. As a last EDI update, on recommendation from the Faculty Minority Affairs Committee that was based, we have agreed to delay the search for the next EDI leader. The recommendation was really based on the COVID situation and the ongoing provost search. So there's a lot going on, so we thought it'll be good to delay that search. The big advantage is hopefully the extended timeline will allow us to bring candidates to campus this fall. Finally, please remember that we are observing an adjusted spring break schedule this semester to reduce the impact of the coronavirus on our campus population. The 5 days of spring break is split into 2 shorter breaks. First break will be February 17th to 19th. The second break will take place March 22nd to 23rd. We will be doing everything we can to encourage students to mindfully use this time to rest, rejuvenate, while keeping themselves and others safe. I'm requesting our faculty to keep this change in mind as they give assignments to their students. I don't have to remind you that we are still going through some challenging times. However, I also want to inform you that we will get through these challenges because of the strength of our community. Because we are thoughtful, resilient, and kind, we care for each other and support each other. So no matter how difficult the times are, I will continue to be hopeful about the future because I believe in you and I believe in our campus. So thank you from the bottom of my heart for being a part of it. Well, that's my update. And now it's question and answer time. So let's bring our panel to answer your questions.
Thanks, Chancellor, for those remarks. As we get feedback here, sorry about that. So yeah, as we started here, we promised to keep the questions, a lot of time for questions. We have about 45 minutes for questions. So I encourage you, if you have a question based on the Chancellor's remarks, to go right into that live question link right at the bottom of your screen there and fill out a question for us. So let me quickly introduce our panel of experts we have for you today. So you heard from Chancellor Reddy. He'll stay with us throughout the rest of the hour. Provost Tom Christensen is also with us on the panel. Vice Chancellor for Administration and Finance, Chuck Litchfield, is here with us. Assistant Vice Chancellor of Health and Wellness, Stephanie Hannenberg, is with us. And Interim Assistant Vice Chancellor for Student Affairs and Retention Strategies is Megan Bell, is here with us as well. So we have about a handful of questions, about 6 or 8 questions for the panel that were pre-submitted. So we'll get to those first, and then we'll get to the live questions after that. So Chancellor, I'll let you catch your breath for a minute, and we'll start with Chuck. Chuck, a couple questions for you. So the first question is, one of our folks asked, will there be any types of grants for students this semester? So I know with COVID and all, there was some money available last year. What does this semester look like? Chuck, you're still on mute there.
Yeah.
There you go.
Thanks, Chris. That's a good question. There will be money available this year. First off, I want to thank this U Foundation again, because they did give us $960,000 again for this semester for emergency aid grants for students. In addition, we are expecting a second tranche of money coming from the federal government. This Relief Act is known as the Coronavirus Response and Relief Supplemental Appropriation Act. We've also been calling it HERF2. We expect a little under $4 million to be made available for students. We expect that money to arrive sometime in mid-February. You will need a FAFSA on file in order to be able to access that money. The maximum grant will be $3,000, and Financial Aid Office will be sending an email to all students about how to access and apply for these funds.
Great, thanks for that update. Changing topics, Chuck, but keep your mic on there. So the Chancellor mentioned briefly about the potential for UCCS being a pod, but that seems to be a heavy topic of discussion today. So can you talk a little more? The question is UCCS going to be a center for vaccinations? And then it leads on, if so, is there a need for volunteers? Stephanie may have some comments as well, but I'll let you start with this one, Chuck.
Yeah, so Stephanie's public health team has given to the IMT a pod plan to execute, and in fact, she and her team are preparing to do a dry run of it in February. As the Chancellor said, we have applied for a pod, and we have passed through the first milestone with regard to review of the state. We are hopeful that we will be selected to be a pod for phase 2, and that phase 2 would presumably start sometime in the spring. And as far as the question of volunteers is concerned, I believe that Stephanie is already got plans for the personnel necessary to execute that pod, but I will defer to her right now and see if there's anything she wants to add on that part.
Thanks, Chuck. So we do have, it's all about timing. So if we are selected as a site for the second phase, we will be using nursing students that are in the public health program. Should we become a pod in phase 3 and it's over the summer, that class is not active. So it is much more likely that we may need more volunteers. I have asked some departments to be our campus partners and help with check-in and line management and social distancing through this. So if you do have a desire to help, please let me know, and I would be happy to invite you to the February 10th simulation that we'll be doing for a couple hours. The health department will be coming as well to watch everything that we do so that they can provide guidance, but we have a very strong plan in place that will be, that I'm happy to talk to anybody about that wants to volunteer.
Thanks, Stephanie. So the next few questions are actually for you, Stephanie. So we'll transition there. So one question is timeline. So when might we see a system in place for vaccine available for our faculty, staff, and students? So we touched briefly on that before, but can you reiterate kind of the timeline, the folks in 1B and then the summer for the healthy folks?
Yeah, so the email that I got Friday late afternoon said we will not be a pod site at any part of phase 1. Which is why we do encourage you, if you are in the categories for phase 1, there are a lot of community sites that are giving it, and that information is on the COVID website. It's the very first FAQ, and it talks you through exactly how to enroll at the different sites. If we are able to become a pod for phase 2, my hope is that by late spring, we will be able to start vaccinations for that group. And again, by phase 3, it'll be open to everybody. And the goal is that hopefully we can get that phase all done by the end of the summer so that everybody can be vaccinated.
Yeah, thanks for clarifying that. I'm watching the questions come in. We have a lot more about timing, but we'll get to those here in a few minutes. So, so a couple more questions about obviously the vaccine. Are there policies and procedures in place for faculty who may not be able to get the COVID vaccine because of allergies or one or more components? So as the question was about faculty, but it applies to staff and students as well.
Yeah, so because all vaccines are what are called EUAs, so emergency use authorization, by federal law, they cannot be mandated. So there is no mandate that anybody has to get the vaccine. Even if it was to clear federal FDA approval, it's a process to get something mandated in the state of Colorado. It's usually a legislative process. And so it is very unlikely that there will be any mandate anytime soon. So I don't think that there's a protocol or a process in place that anybody needs to be concerned about. What I would say, though, is if you want the vaccine and you have any of the allergies, typically you'll be referred to an allergist office that is able to monitor you much more closely than going to a pod site. So I would work with your primary care provider, or with, if you already have an establishment with an allergist, I would work with them to get it scheduled so at a site where you are much safer.
All right. I have a two-part question here for you, Stephanie, so we'll keep talking about vaccines. The question is, will student teachers going into schools this year receive the COVID-19 vaccine before they do so? And the second part, someone asked about nursing students. So comments about our students who are out in the facilities working this semester.
Yep. So we got our nursing students taken care of through their clinical sites. So they are all being vaccinated, either have already been vaccinated with their first dose or will be vaccinated in the next week or two. For those that are in the next phase, that are students, whether they're a teacher or they're a school counselor that'll be doing an internship in a school, anybody that is going to be in a K through 12 setting, I have already talked to the health department to get us on a list to be pre-established so that we can find them a location to go with their group. So it's already on the health department's alert. Therefore, the health department has asked that every person does not individually call them to ask if they can go there to be vaccinated, because we will send people in groups. We will find them a site, they will register through that site, and then they will go as a cohort and be vaccinated. It is a very quick turnaround. So when it is your turn to be up for one of these things, I will just tell you, you have to be vigilant about watching for the sign up, and you have to be extremely flexible because there is not a lot of leeway with this.
Yeah, it's lots of moving parts here, as Chancellor said. It's very, very confusing. So another question about the virus. With the new COVID-19 variants that are more contagious than others spreading across the U.S., how will campus deal with this increased threat? Do you have any work leading up to that yet?
Yeah, so here in the United States, we have the UK variant. The good news with that is that the research that has been done shows that the vaccine is actually very effective for that same variant. So they are working on a booster dose already that people can get as well. The state is tracking it. So how they're tracking cases here is when they get positives from different labs, they're taking 5 samples from like 15 different labs a week that are positives, and they're sending them to the state health department so that they can continue to monitor for the variant, because most labs don't have the capability yet to look for those variants. So the health department is selecting where they pull from. Even when people are vaccinated, though, we're still going to be wearing masks. We're still going to be social distancing for a while. So we have all the measures in place that as long as we continue to follow them, we should still be able to be very safe in how we're moving forward. So please don't think that if you get a vaccine, you can stop doing all those safety measures, because that is what's actually going to help us as these variants pop up. We've had 3 variants in just a few months, so I would anticipate we might see others. So this is going to be key to keeping us safe.
That's great. Thanks, Stephanie. We'll let you take a break here. A couple questions for the Chancellor right before we get into the live questions, which are flowing in. So continue to submit your live questions for us. So, Chancellor, right at the top of your remarks, you mentioned furloughs, but it went by pretty quick there. So can you restate or explain again what the status is of the furloughs?
So as you know, the census date is on February 3rd, right? Until that date, we really don't lock in the enrollment numbers. So we have to wait till the end of census date. And so on February 4th, we're able to say. So the whole idea is we're looking at the revenues. So we are down about 7.5% in enrollments right now. And as I mentioned in my remarks, if the trend continues like it has in the last few years, then we are still good to go towards restoring those furloughs retroactive to January, or getting relief for the furloughs retroactive to January. So that's what we're looking at.
All right, thanks for explaining that again for us. So, Chancellor, the other question for you is, folks have asked about working from home. We've all been working from home now for almost a year, or some of us have, for almost a year now. So they're wondering what the work from home situation will look like after the vaccinations are rolled out, so as we get towards the fall and next year.
So obviously we're learning a lot. And one thing we did find out is many folks have been extremely productive working from home. So we need to carefully evaluate these choices. And really, this should not be a global thing that we're going to do, but let people work with their supervisors as they evaluate these things. But I do want to take advantage of the silver linings that we're going to have here and say, how best can we look at working from home? How do we maximize the usage of infrastructure at this point? Because not everybody can work from home either, right? Given the type of job they're going to do. But let's kind of keep talking about that. I think we have time, and my hope is to create a task force that looks at future of work, if you will. That is, how can we align ourselves where, with or without COVID, that we'll be able to work from home and be effective. As many of you heard me say, even from a strategic planning perspective, that as our focus ought to be on outcomes more than activities. So if we can focus on the outcomes, I think that's what needs to be evaluated. So I'm very hopeful. I think we'll have good conversations across the campus, and let's get to a good point where we continue to help our students succeed as we also support our faculty and staff.
All right. Thanks, Chancellor, for explaining that one. So we're going to dive in now to the live questions. So that concluded our pre-submitted questions. So they're coming from all different angles here. So we'll start this one. I think Chuck can answer this one, but Stephanie may have some comments to add to this. So 3 people are asking about this one. It says, has the campus received any guidance or indication from the state about whether higher education faculty and staff will be included in the educator category for vaccinations and status 1B? So I noticed some meetings recently about that at the state level. So Chuck, you want to start that? You heard?
Yeah, sure. So I attended a meeting about 2 weeks ago now with CDHE, which is the Colorado Department of Higher Education, and CDPHE, which is the public health at the state level. And it was, in fact, mostly to talk about this question of, for those of you that have seen the Colorado website, when we look at frontline essential workers in education, that was really the question: is does that include higher ed? And we were asked to provide some information to the state about which of those educators would be impacted in the higher education arena. They have taken that data. They also took our data with regard to the K-12 interns and the nurses and our essential workers. And so they're looking at that definition, and we do expect some feedback from the state on whether higher ed will be included in that educator definition.
Excellent. All right, next question. Laura, this is about performance evaluation. So we'll start with you. The Chancellor may have a comment to add there. So that's kind of a long question. So, but this spring, they recognized that there was a new performance rating rubric came out, which seems to make it a little more difficult for an employee to receive a 5 rating. So given that we've had a lot going on this last year with the pandemic and furloughs and all that, the question is, what is the rationale for rolling out an incredibly stringent rubric in a year where only the measures of employee success is that rating? So it feels like it runs counter to what we've heard about, appreciation for our hard work in these difficult times. So thoughts on rolling out the new performance evaluation this year?
So it's not a new form or process this year. We just had a question revised to be able to get from employees what they feel may have impacted their goals that were set last year when COVID hit. So there's an opportunity, as the Chancellor just described, to talk a little bit about how their goals may have been changed, how the environment that we're currently in affected their ability to complete them. As far as the rubric goes, that was available in previous years. That thing has been available for a number of years, from what I understand. This year, we decided to attach it to the communication piece about performance management because so many supervisors ask us, gee, can you give us a little bit of help in making the distinction between, a 3, a 4, or a 5? And we just happened to have this tool that was already available. And so we just happened to attach it. But there's nothing new with that rubric or the definitions of the 3, the 4, and the 5. That's been out there for a while. We just brought it forward this year to help people.
So, Chris, just to add on to that and reaffirm what Laura said, we thought it actually is good for the employees to see that they have an opportunity to explain as to how COVID-19 has impacted them. I think it's also an opportunity for the campus to learn a lot about all the challenges faculty and staff had to go through. So I think that would be actually more of a help for them and would actually benefit, I'm hoping. So it's more of a help for them more than us trying to put more questions in. We thought it's an opportunity for them to express, hey, look at all the things we had to go through, and also give more information to the supervisor in terms of them having any kind of challenges.
That's perfect. Chancellor, you can keep your mic on here. So the next question is about commencement. So the question is simply, what is commencement looking like so far for this spring? And then it leads on, if we have an in-person commencement this spring, how many guests can we allowed to bring? So thoughts on commencement coming up in just a short 14 weeks, believe it or not.
Can I take a rain check on that, and maybe we can talk about commencement in the next town hall? Because this is a question we're still pondering on. I think we're going to make a decision sooner than later. Hope to make that call this next month. So I'll have more to say on that. But at this point, I think it is still challenging to bring people together. I mean, there are not enough places out there. I mean, if you look at those who've been to the commencement, World Arena just gets packed. And if you do social distancing, I don't think there's a place in the city that can hold it. So we want also to be fair to everyone. If you ask me to make a call today, it will be virtual. And it could still be virtual when we meet in the next town hall. But just know that, I'll repeat this again, that's a very special day for me personally, because I look at that as a coming together of the completion of the graduate, and where we faculty and staff take pride in our students. So that's a special thing for me. I would not hesitate if I had any opportunity to make that a live event. So please know my heart and mind are there.
Thanks, Chancellor. We'll look forward to next month, and hopefully the vaccines will be out and we'll see a little trend moving in the right direction. So, next question is, we'll start with Chuck. Laura may have a comment to add to this one, but Chuck, can you talk about the criteria that is used by the committee who approves promotions and new hires? So Chancellor talked a little about the statistics for that committee, but can you share a little bit more about what the criteria is for filling positions and new hires?
Thanks, Chris. Yeah, so you're talking about how the Position Review Committee's charter is set up?
Sounds like it.
Yep,
Yeah.
That's how I'm interpreting it, yes.
Yeah, so the Position Review Committee's charter is not to judge whether the position is needed by the unit, right? The unit's already gone through a request for the position process. The committee is reviewing the budget situation and what type of priority the hiring managers and the associated VC or dean have put on these positions. And we've really been focused on those positions that are general funded. So for example, where we have had positions that are funded by grants or positions that have been funded by other funding mechanisms, we have reviewed them because we believe it's important to review all the positions. That was one of our charter pieces, but we've really tried to make sure that we're very liberal about pushing those through. For the general funded positions, we have reviewed things like whether we are taking salary savings for that position already, what the impact to the potential budget for the unit and for the campus might be with regard to those general funded positions, and whether filling the position meets a level of urgency where it could be deferred to take some time, to take some savings, and then put back in. They're very difficult decisions. And as the Chancellor pointed out, we've looked at over 150 positions, and we really try not to start with the no answer. But we do have to be mindful, particularly early on in the COVID, when we didn't know what a lot of our budget impacts were going to look like. That was really the purpose, is to make sure that we could continue to fund and pay the salaries of the people that we had here, and not try and incur additional cuts. And it worked pretty well. It did put a strain on a number of units, and the PRC members are very aware of that. If anybody's curious, the PRC members are myself, the provost, and the vice chancellor for student affairs, Carlos Garcia, and then Laura Alexander as the CHRO and Suzanne Scott as the budget officer work with us ex officio to make sure that we have all the data that we need. It is also the case that both of them sometimes have questions that we have to go back and research. Anything to add, Laura?
No, I think that's it. The primary role of myself and Suzanne is to provide support, but we can sometimes offer some clarifying information. And Chuck's right, a lot of times we have to go back. Sometimes it's an HR question and I need to go back and talk to my team to get clarification. And sometimes it's a budget question where we need to get clarification. So it's a fact-finding mission at times, yes.
Yeah, and I just want to add one other thing that I forgot to say, and we did put in place an appeal process. So in cases where a dean or a VC felt strongly that that we had missed something, we did in fact offer them an opportunity for an appeal. In no case did we ever cut a position. right? It was always about a question of deferral and when it would be time to post it. I think that's really important for people to understand. We never cut a position, we only did deferrals.
Correct.
Yeah, that's great background information in the time with the statistics the Chancellor shared earlier about how we filled most of the ones that have been requested with a few deferred, so till later. All right, Chuck, leave your mic on. So next one is for you. You wear a lot of hats from IMT to finance and everything. So lots of questions coming your way. So this one says, the campus is mostly remote for the first few weeks of the semester. Why are some services, and they didn't give an example of what they are, that can theoretically be done remotely still being offered in person? So I don't know if you have any thoughts on that one.
Yeah, so that there are a lot of services on our campus that are really important to the support of our staff and faculty, and most especially our students. And we have learned a considerable amount about being able to offer these remote services, but we also recognize that in order for us to ensure that our students have access to the services that they need, that some of these services need periodically to be in person. And so I can give you some examples, right? Both the bursar's office and the financial aid office are not open every day for in-person engagements. Appointments can be made, and they also have office hours so that, you know, students that have questions that are either limited on how they can access things remotely or just really feel like they need to have an in-person engagement can do so. And I know that in student affairs, that has been a significant issue for advising and for Dean of Students and for the Disability Office. And I know the library is the same way, right? They've really endeavored to have the opportunity for students to use the services that are really only present on the campus. And so we haven't taken everything remote because of that.
Thanks for the explanation. So you can take a break for a minute, Chuck. We'll transition to Laura. So Laura, this question is about the Colorado Equal Pay Act. This question is, what steps is Human Resources taken to comply with the act? And when can we expect education and guidance on what do other departments need to do to support this?
Right, so the Colorado Equal Pay for Equal Work Act went into effect on January 1st. We've been working with our sister institutions, the system level attorneys, and folks from a company called Aon who actually did the study. Some of the preliminary results have come in to the various campuses in terms of positions that may need to be adjusted or at least further looked into to see if they need to be adjusted. So currently my staff is reviewing the findings or the proposed findings and doing an analysis of each individual one by one to see if there are defendable reasons why there might be a pay discrepancy. And we're finding that a lot of them can be debunked, so to speak. So that's good news for the budget impact, but we're still reviewing the data and making sure we do have a pay disparity situation. When we know that, we then will go out to the departments and talk about how to resolve those pay inequities. So that's kind of where we are right now is analyzing the data, talking with cabinet members about strategy.
That's great. I'm glad you're here to help explain that for us. It's very complicated. Stephanie, you've got a vaccine distribution question again for you. This is, if UCCS becomes a pod for vaccination, will only UCCS students, faculty, and staff be allowed to get the vaccine, or is this a community access point? So, thoughts on that?
Yep. So our memorandum of understanding with the state or with the local health department is that we're a closed pod. So it's for the UCCS community. So we will not be having community members. It will be strictly for our faculty, staff, and students based on whatever priority phase we're in at the time.
Perfect. Nice. Short answer. Thanks. Mm-hmm. Chuck, back to you with a budget process question. So what steps to increase transparency in the budget model process are being considered? I feel as there is a little change and it remains a bunch of meetings and directors above, especially central support units having conversations here. So kind of what's going on with the new budget model, I think is the overall question there.
Thanks, Chris, and I'll actually start with the transparency piece. So we are continuing with the progress on the building of the budget model. The model itself is built, although the Budget Model Steering Committee is still meeting. It's being convened by the provost to specifically look at governance issues. We spent a lot of time with stakeholder groups in the fall listening to governance concerns. And so we're trying to synthesize those and come up with a proposal for a governance process, which we will then socialize again for comment and for people to weigh in on. As far as building the budget model, we have had some very specific discussions with the deans and with the VCs on what the budget model will look like for them. And we are in the process of trying to build out what that might look like for FY22 to give them an idea of what that budget looks like. We have also set up a series of training modules, which we are passing through a review process right now that will allow us to do general meetings with general campus stakeholders to be able to understand how the model works and to look at a lot more of the details. And we expect a lot of that training to start here in a few weeks.
All right, in process. Thank you. Chancellor, we'll start with you with this question. It's about campus morale, so we'll let you make a comment, and others may want to weigh into this as well. It says, what are we doing to boost morale for all of campus? Some have had to take on additional duties, furloughs, and there's people are looking for a little support for morale building here. So thoughts on campus morale?
Great question. I think communication is a very important part of that campus morale. So we're doing, I don't remember, I mean, this is my 38th year. I don't remember the last time how much we communicated with the campus as much we're doing, and making sure that they know that we're on this together, that we're going to get through this together, and letting them know whether the news is good or bad, that we're going to share this with you and get your input in many of the things that are happening on the campus. We're also trying to do this in different layers. So I'll ask folks on the panel to speak up as to what they're doing in their different ways. It is challenging. I mean, I think that we just had to accept that this is not going to happen by itself. And so I'm also open to any ways that people suggest that how can we build morale if we could. I mean, if you look at some of the initiatives we have taken on, the whole mental health issues is really to support saying, hey, we understand that there are mental health issues across the board. And when we start focusing on the students, we quickly learned faculty and staff are very much impacted by it. So we took measures to put those in place. Same thing with the EDI efforts, right? Equity, diversity, inclusion efforts as well. So I believe that we're trying to do as much we could, but if we're missing the mark on anything, I welcome the input from our campus citizens, and let's figure out how to do it. I mean, there are some units that are doing some interesting things. They are forming their own unit and say, okay, let's go climb the incline this Saturday. So also encourage folks to come forward with ideas they have, and let's share the best practices. If there's a way we can strengthen that morale, I think we should do it, absolutely. I think we're in this together. So anything we can do, we will do it. If we are not doing it right, let us know, and we'll make adjustments. And I would like other panel members, if they would like to add to how we can do it.
I was going to say, Tom, we have a couple of hundred faculty members on the call today. Anything specifically for faculty? I know they've taken on, remote learning and all that. So thoughts on the morale there?
Yeah, I mean, so certainly morale is a problem, an issue for faculty as well as for staff. And so one of the things we're trying to look at are particular groups of faculty that have been impacted. For instance, one of our biggest concerns are the tenure track faculty who are still on the road to tenure. That's a group that we're particularly concerned about. We provided a tenure clock stop last year, and I've been talking to the deans and the provosts on the other CU campuses about the possibility of doing that again this year. So that's under active consideration. There's so much that needs to be done. I certainly encourage faculty within units to be supporting one another. it was just amazing last spring to see how the faculty reached out to one another, and those that were experienced with online education, helping those that were new to it. And so that's got to continue. We've got to continue working together to try to use and share our expertise to support one another and to support our students.
Great insight. Thank you. Chancellor, you mentioned commencement a few minutes ago when we had a comment. So has anyone looked at the opportunity of using the Air Force Academy outdoor stadium for commencement? So I know there's lots of options on the table right now. Thoughts
Sure.
on?
Well, I think Air Force Academy would be great if you want to do it, but right now they're not allowing a single person to enter if you're not part of the academy. I'm not sure. I mean, some of you might know, I'm also serving as an honorary commander, so I do have a pass. I'm not tested if I could enter the academy yet. So, but they have some strict enforcements. Even in a regular year, we can't count on that because it's a federal institution. I mean, it could close anytime. You plan all this and you can't enter. I wish Andrea Cordova was on the call with us. She would be happy to jump in and tell you how much challenges she takes on. I mean, this is huge. I mean, she's not wasting an opportunity to figure out how best to celebrate our students. So love to have that opportunity, but it's not that simple.
All right. We still have 15 minutes left, but we're getting towards the end of our submitted questions. So just a call out to anyone watching the show this afternoon. If you have a question, please get it in now so we can be sure to get to your questions. So we do have a few extra minutes, but our pool of questions being submitted is drying up a little bit, but we do have a couple more, so we're not quite done yet. So Stephanie, come back to you for a vaccine question. So you talked earlier about the student nurses getting their vaccines, but can you reiterate again about student teachers working in K through 12? How and when will they be eligible for their vaccines?
So they are not eligible until 1B below the line. So right now we're in 1B above the line. So if you look at the chart, the reason I say that is there's actually a line. So they will be in the next phase. How it has worked so far is that when we have a set population like that, I work directly with the health department to open up a site for them. So whether it's one of our local hospitals or a pharmacy, I have to send them a name, an email address, and what the role is of the person. Then they have to take an ID. It's a very controlled process so that nobody can slip in that shouldn't be there. And then they have a very small window to enroll, usually less than 24 hours. And then they have about a couple days to get it done. So when they miss a window, it makes things really complicated because then we have to start over. So I will be working directly with the deans and any professors that are overseeing those programs to make sure that when we're ready to roll, that communication is going out in a really timely manner so that we can get everybody taken care of. So if I had to guess, I would say that they will probably be up for vaccination in February because we have to finish the current population. You should also note 1B above the line right now includes 70 and up. There has been discussion with the state of moving it to 65 and up. Should that happen, it may delay things just a tiny bit. So people just need to be prepared. But my hope is that we'll get them in, as well as school counselors and others going in K through 12 by end of February. But I will be in touch with everybody that's directly affected by that as soon as that happens.
Perfect. Thanks for clarifying that. So Chancellor, question back for you on the provost search. So you mentioned in your remarks that you've delayed the equity, diversity, inclusion, Assistant Vice Chancellor, because of the provost search, but can you give us an update on the provost search? Where are we at with that?
Absolutely. So the provost search is coming along really well. Dr. Don Rabin, Dean of Engineering, and Dr. Marianne Cutter, Professor Marianne Cutter, both are doing an amazing job as co-chairing that search. So the last update I had is we had about 136 applications for the position, and they are vigorously working at narrowing that search. The search committee is actively working at it. So if everything goes well, hopefully March, April timeframe, we might be talking to the candidates.
That's Great, thanks for updating there. So, okay. Next question, Chancellor, we'll let you have the first shot at this one. It's just an idea that someone threw out. Has any thought been given to enforcing meeting-free days this spring as a means to relieve some of the screen fatigue and removing a little bit of the, improving a little bit of the mental health? So it's
okay, please sign me up for that program. I'm ready to take it. I'm sure everybody on the panel are going to raise their hands. What I realized is working at home is not that much fun, trust me. I think we miss seeing our students, faculty, and staff. I would be the first one to say, we got to figure this out. But you know, COVID-19 has done a number on us, right? I mean, there's so much work it has created. And one of the things I've quickly realized is before, let's say you had to set up a meeting in Denver, it would take 2-3 weeks. Now they can come into your session in 5 minutes. So I do think all that has, technology has its benefit, but definitely has challenged us. So I think it's kind of time to review and say, okay, how do we do good time management? Because the goal is not to burn out with these meetings, right? So hopefully we have learned some lessons through this and see how we can manage our time. And again, I'll repeat what I said earlier, how can we stay focused on outcomes so that we can really do a good job? What have we learned in terms of these meetings? But I'm open to ideas. I've not figured out a way to take meetings out of my day unless you're on vacation or in the past furloughs. So I think I'm waiting for ideas too. Happy to take them if somebody has figured it out. Maybe Laura has an answer because she's in HR.
You know, thank you, Chancellor. I've thought a lot about that as well. And I think it really kind of falls on the individual because it's really hard to say as a campus, day X will be a no screen day because, you know, of all the things we have going on and all of the days, Monday through Friday, are kind of on the table. So I think from an individual standpoint, you would just have to say, I need a block of time this week that I'm not on any calls. So I'm going to block off 4 hours on Thursday morning or 4 hours on Friday afternoon, and I'm just going to block it off in my calendar. So that's kind of worked for me in that there are just some times when I just can't be on anymore. And so I need that. I know that this week I'm going to need that block of time to not be on the screen, and I just put it in my calendar myself. So that would be my best recommendation.
So Chris, it's really about mindfulness. If you are feeling that you are kind of getting stressed out with this, I would suggest please take action. It's really hard for somebody else to figure that out for you. Again, repeat, health and safety. If things are getting to you, just reach out to your colleague, talk to your supervisor, just say, hey, I'm struggling with this, can I get a break? Like Laura said, I really wish we could have a no meeting day, but it doesn't work that way, right? So I would suggest that don't ignore it.
Well, we're getting towards the end of our time here. We have time for a couple more questions. So, Tom, you've had a chance to take a break here during this. So, second to last question is for you. So, the student mentioned about classes maybe returning in-person learning after February 22nd. So, can you just talk briefly about, when the remote learning is over and we transition back, kind of what does that look like? Is everybody coming back or some of us coming back? What's the plan leading into after February 22nd?
There certainly has been some confusion about that. And what will happen on February 22nd is that we will return to the modes of instruction that the classes were originally scheduled to be in. We are not able to return fully to campus because we are still in the pandemic. We are still needing to socially distance, and that means our classrooms still have limited capacities. So right now, we took classes, for instance, that had originally planned to be on campus, and we have temporarily gone remote for these first 5 weeks. Those classes will return to campus. But we had other classes that were originally scheduled to be online or remote, and those classes will remain online and remote when we get to February 22nd.
Yep, you're right. A lot of discussion around that. So thanks for clarifying that. So, So last question, Chancellor, is for you. It's about online learning. So the question is simple. What is your vision, Chancellor, for online learning at UCCS in the future?
So online learning, I mean, I could be a little bit biased because I lived in that world for a long time, but clearly the experience that we had has helped us navigate COVID-19 much better than many universities could. So the way I look at online learning is I think we need to recognize that it's not one size fits all. Students study in different ways. So we as a campus should be offering different delivery modes so that our students have that flexibility and convenience to pursue their education. But online also helps us reach to a much broader audience. We need to have a thoughtful strategic direction saying, okay, how many students should we have online and how many do we have on campus? So I don't see online going anywhere. I think it's a matter of how do we thoughtfully navigate online, and we don't just kind of do random things saying, okay, online will make money for us, so let's kind of just go and get as many students as possible. I think we should stay true to our mission, vision, and goals. That's what should be driving us. So we'll be engaging everybody in those conversations. We should be thinking about what can online do for our students. That's the most important thing. We are a comprehensive regional research institution, the only one in Southern Colorado serving the state. Think about how many students we can help living in Southern Colorado that don't have access to education or come to the campus. We need to be thinking in those directions. How can we increase a diverse population? We need to be thinking about how do we help our military students through online education to help them complete. So I think if we pursue with a good heart and mind towards that, I think we'll be successful. How do we support our faculty effectively to offer those classes? So there's a lot of infrastructure that needs to be built up to make that happen. So I would say, let's continue to keep our vision, mission solid and figure out how can we provide more access and opportunities for our students. So I would say there's a lot of work to be done, but I do think we have a culture where faculty are used to teaching online. So I would say let's continue that path and only get better in serving our students.
Thanks for that, Chancellor. So that brings us to the end of our Q&A session here. So I want to thank all of our panels. Megan, we didn't have any student affairs questions come up, but in the remote status, that's not surprising. So thanks for everyone for taking the time. And I'm going to turn this over to Chancellor Reddy for a few closing remarks to bring us home here. Chancellor.
All right. Thank you so much, Chris, and really appreciate you facilitating the session. So I want to close out today with a message from one of our students, Trenton Reneke, who emailed me this week. So let me tell you what he shared with me. He said, when he began classes at UCCS, he faced struggles that seemed insurmountable. His grades were slipping, he was having a hard time paying for tuition, and he was on the verge of dropping out. Then a close family member was diagnosed with cancer as this all was going on. So instead of surrendering to the circumstances he faced, Trenton decided to switch his major to biology. He wanted to learn how to fight cancer so that one day no one would have to face what his family was facing. Today, he's maintaining a 4.0 GPA. He has volunteered for over 1,000 working hours as an EMT for local hospitals. He's earned multiple academic scholarships and conducted cancer and diabetes research. He will be graduating this May and has just accepted an offer for his dream job, working in cancer research at a major hospital. So Trenton shared, there were many times I questioned myself, but I have been blessed to have some of the best professors and mentors from UCCS. UCCS truly does fuel success. So I know these times are hard. I know that some days the struggles can feel insurmountable. But on those days, please remember Trenton and everything that UCCS has meant for him. So I want to tell you, your work is important. You are contributing to great things and you're transforming lives for the better. And there's always hope that tomorrow will be a brighter day. So with that, I want to thank you again and wish you a very happy new year.
Wow, what a great way to end this. So thank you so much, Chancellor, for those words, and thank you to Trenton for all he's done to share that with us. So again, thank you everyone for the panel for being here today. With that, we will conclude today's town hall. We'll see you guys next month for the February town hall.